It all started with an ad in the paper and I had been thinking about doing something like that because I have some friends that have done this type of thing. And one of them, who I consider to be in very good health, came back with some negative results. And fortunately, upon further testing, it was not that serious, but it certainly gets you thinking. And so I saw this ad in the paper, and the price certainly seemed right. And coincidentally, my wife, Sandy, had a doctor's appointment scheduled for the next day, and I said, you know, why don't you take this in and see what your doctor thinks about it all? And she did, and I'll tell the story, and then she can tell her side of it. But the doctor essentially said, these are great tests that I couldn't begin to perform for this kind of price, and on top of it, unless I have some reason to order these tests, I can't do it at all. And at the time, they discovered a little something about Sandy that they wouldn't have pursued had it not been for her raising the question.
Yes.
Because you went in to ask about the test.
Because I did the test, she said that the test that HealthFair could do would be a good diagnostic start for us, and that if they found anything that indicated any kinds of concerns, bring that information back, and they would follow.
We did sign up. The date eventually rolled around, and we went to the parking lot where the bus was situated. And at first we thought this was just like the bus that they carried their equipment around in, and that they must have been inside the store or something like that. So we get out and we go in the store, and they say, well, they're in that bus. Okay, but the bus there's like no visible signs of life from the outside, no line getting in, but we tentatively knock and they say, come on in. And although it's a big bus to begin with, amazingly, it's bigger on the inside than it is on the outside. The decorating is tremendous. The people were tremendous. They were all very friendly. There's some paperwork to fill out. We didn't have to wait very long, but there were some people there when we got there. And almost prophetically, I asked how long it takes to get results, and they said, well, a week to 10 days unless we find something wrong with you. Little did I know. And so Sandy went in one of the rooms, and I went in the other, and we had our tests done. I'm sort of a technical person, so I really enjoyed hearing what the tests were accomplishing and how they were done, and they were very the staff was very friendly in explaining it all and demonstrating what they were going to do and that, so I appreciated all that. And I didn't know, as it turned out, they were taking longer than they would have normally, but they found this thing wrong with me, but I didn't know that. So Sandy got done before me, and would go out, and out of the room and into the lobby and say, well, okay, we'll see you later. And they go, well, Mr. Arundale, can you wait a minute or two? And I'm thinking, well, there must be a problem with the credit card, or I forgot to sign something. And Sandy goes, there might be something wrong. And I'm going, well, I'm healthy as a horse. There can't possibly be anything wrong. Well, sure enough, 5 minutes later or less, they come out and tell me that I've got an abdominal aortic aneurysm, which I have no idea what it is, and that I shouldn't do anything strenuous, and I should get in to see my doctor right away, and essentially put the fear of God in us.
Within minutes, we were on the phone to our doctor saying we just had a healthcare screening, and I think, what did your aneurysm measure? 6 point?
No, well,
There?
HealthFair diagnosed it at 5.5 centimeters, and I guess normally it's supposed to be like 1.8. And our doctor was kind enough to get us in that afternoon, and
That's when you know it's a big deal. When your doctor gets you in that afternoon.
well, HealthFair is pretty amazing that they can do all this for so little money, yet doctors can't order these kind of tests without some sort of cause. And I do want to point out how caring healthcare is, because long before we were asked to do this, about 3 months or maybe a little less after my initial visit to them, I got a phone call, them asking how I was doing and all that. I thought that really put them over the top. I mean, they really care.